101. In today's live broadcast, we're going to be talking about kidney disease. What is kidney disease and its symptoms? Okay, and do not forget that this does not constitute diagnosis or treatment. Okay, so what we are doing here is to give you some healthcare awareness, and we strongly encourage you to go for your medical checkup, medical screening, your routine procedures. Okay, that's why we offer free transportation for anybody living in our community that cannot afford the transportation to his or her doctor appointments. We do that for free. So what we are doing here is not diagnosis. We don't diagnose anybody. So get that straight. So what we are simply doing is creating health awareness, because we believe strongly in Gateway 101 that prevention is better than cure. So this again does not constitute diagnosis or treatment. You need to see your medical provider. Okay? So we're just going to be, we are giving healthcare awareness. We'll give you some simple tips. If you notice this, if you notice that in your body, go for checkup. If you notice this, that this is not right, that is not right, go for checkup. So we are creating health awareness. That's what we do in Gateway 101. Then we also have a simple home remedy that can also help alleviate pain symptoms. Okay, so let's get that straight. So, in today's live broadcast, we're going to be talking about kidney disease. So, what what is kidney disease and what are the symptoms? Remember again that this does not constitute diagnosis or treatment. See your medical provider for proper diagnosis, proper screening and treatment. Okay, so kidney disease is when the kidney become damaged and can't properly filter waste, extra fluid and toxic from the blood. Since kidney also help control blood pressure, balance minerals, and make hormones for red blood cell production, kidney disease can affect the whole body. Okay, kidney disease can affect the whole body. I repeat again, kidney disease is when the kidney become damaged and cannot properly filter waste, okay, extra fluid and toxic from the blood. Since kidney also help control blood pressure, kidney also balance the minerals, and kidney also make hormones for red blood cell production. Please kindly subscribe to Gateway 101, share and like this video. Okay, so kidney disease can affect the whole body. Do not forget to subscribe. Very important. Subscribe and like. God bless you. So these are two main types of kidney disease. So the first type will be acute kidney injury, AKI. Acute kidney injury is a sudden loss of kidney function. It might be for hours or for days, but often reversible if treated quickly. While chronic kidney disease, CKD, is a slow, long-term loss of kidney function over months or years. Okay, so what are the common symptoms of kidney disease? Common symptoms of kidney disease will be early kidney disease often have no obvious symptoms, which is why it is sometimes called a silent condition. Symptoms usually appear when damage become more advanced. Okay, changes in urination. This is one of the most common symptoms of kidney disease. Urinating more or less often than usual is a form of kidney disease. Foaming or bubbling urine may indicate protein loss. So if you urinate and you notice a foaming or your urine become bubbling, this may indicate protein loss. Okay, blood in the urine might also be a common symptom of kidney disease. Pain or difficulty urinating may also be a common symptom of kidney disease. But please know that this does not constitute diagnosis or treatment. Okay, we're creating, what we're doing here is that we're creating health awareness. So frequent nightmare urination, frequent nighttime urination, I mean to say, those are common symptoms of kidney disease. Swelling, edema, we talked about that yesterday. Because kidney can't remove excess fluid, swelling in the feet, ankle, leg, puffiness around the eye, swelling hand might be a common symptom of kidney disease. Please kindly subscribe. Very important. Kindly subscribe to the channel. Fatigue and weakness. Kidney help make hormones that produce red blood cells. So damage can lead to anemia. Do not forget now that kidney help produce a hormone that kidney help make a hormone that produce the red blood cells. So damage can lead to anemia. So if you become constantly tired, constant tiredness, it might be a symptom of kidney failure. Loss of energy might also be symptoms of kidney failure. So shortness of breath might also be a symptom of kidney failure. Loss of appetite and nausea, because waste buildup in the blood can cause poor appetite. You no longer have the urge to eat because waste that is built up in the blood can cause loss of appetite. It can also cause nausea, vomiting. It can cause metallic taste in the mouth. So these are some of the symptoms of kidney failure. So kidney disease can cause or worsen hypertension. If you're a hypertensive patient, kidney disease can cause it, or that you can actually worsen it. If you're a hypertensive patient, kidney disease can worsen it because persistent high blood pressure, headache, sometimes just some of the symptoms of kidney disease. Skin problem, because weight buildup may cause dry, itching skin. Okay, darkening of skin tone in several cases. Kidney failure can also, is another symptom of kidney failure might be a muscle cramp or mineral imbalance. Kidney balance, kidney balance calcium, kidney balance potassium, and kidney also balance phosphorus. So muscle cramp, tingling sensation, irregular heartbeat. If potassium is high, you might have irregular heartbeat. Trouble concentrating or confusion, when you have toxic buildup, it can affect the brain. Difficulty focusing, dizziness, mental fog. If you're having a kidney, these are some of the symptoms of kidney disease. When to seek medical help urgently. So we said go to a doctor or emergency care if you notice severe swelling, mostly in your ankle, in your feet, puffiness around the eyelid, your hands, and your stomach. So seek medical help immediately. Limit a little or no urine output. If you're having little or no urine output, please seek medical help immediately. Blood in urine. If you're urinating blood, please seek medical help immediately. This might be a symptoms of kidney failure. Severe shortness of breath, please seek medical help immediately because this might be a symptom of kidney failure, kidney disease. Chest pain, seek medical emergency care. Persistent vomiting, you need to seek medical help. What are the common causes of kidney disease? One would be diabetes, is the most common cause of chronic kidney disease. High blood pressure is another cause of chronic disease. Kidney infection or stones can also cause kidney disease. Autoimmune disease like lupus can also cause kidney disease. Long-term use of certain painkiller, mostly your ibuprofen, long-term use of ibuprofen, naproxen, can also cause kidney disease. Okay, so for the sake of you who are just joining us, please kindly like and share this broadcast. Kindly like and share. Okay, subscribe to Gateway 101. So for the sake of you who are just joining, we're going to go back again and talk about kidney disease. Okay, so we'll say that kidney disease is when the kidney become damaged and cannot properly filter waste. Extra fluid and toxic from the blood. Since kidney also help control blood pressure, balance minerals, and make hormone for red blood cell production, kidney disease can affect the whole body. These are two main types of kidney disease. Number one is acute kidney injury, also known as AKI. It's a sudden loss of kidney function, hours to days, but often reversible if treated quickly. We also have the chronic kidney disease, CKD, slow long-term loss of kidney function over months or years become chronic. And we'll say that some of the common symptoms of kidney disease are early kidney disease often has no obvious symptoms, which is why it is sometimes called a silent condition. Symptoms usually appear when damage becomes more advanced. So what you will notice will be change in your urination, urinating more or less often than usual. You have a foaming or bubbling urine. It may indicate protein loss. You have blood in your urine. These are some of the common symptoms of kidney disease. You also have pain or difficulty urinating. That's some of the common symptoms of kidney disease. Frequent nighttime urination. Also some of the common symptoms of kidney disease. Swelling, edema, which we talked about extensively for the past 2 days now, because kidney cannot remove excess fluid. Swelling in the feet, ankle, leg, puffiness around the eye, and swollen hand become obvious. Fatigue and weakness. We also say that kidney help make a hormone that produce red blood cells. So damage can lead to anemia, constant tiredness, low energy, shortness of breath. So loss of appetite and nausea occur when waste build up in the blood, can cause poor appetite. Waste build up in the blood can also cause nausea and vomiting. Waste build up in the blood can cause metallic taste in the mouth. Okay, so high blood pressure, kidney disease can cause or worsen hypertension. Okay, because persistent high blood pressure will be some of the symptoms you will notice. Headache sometimes. So skin problem, waste build up may cause dry, itching skin, darkening of skin tone in several cases, muscle cramps and mineral imbalance, kidney balance calcium, kidney balance potassium, and also kidney balance phosphorus. So muscle cramp, tingling sensation, irregular heartbeat will be noticed if potassium is high. Trouble concentrating or confusion because of the toxic buildup can affect the brain. Difficulty focusing, dizziness, mental fog as a result of what of idiopathic symptom of kidney disease. So when to seek medical help? We said go to a doctor or urgent care immediately if you notice severe swelling. Go to a medical doctor or urgent care immediately if you notice little or no urine output. Go to urgent care immediately if blood is in your urine. You notice severe shortness of breath, go to your medical provider immediately. You notice chest pain, go to your medical provider immediately. You have this persistent vomiting, you need a medical help. Okay, so common cause of kidney disease, CKD, common cause of kidney disease will be diabetes, which is the most common cause of kidney disease, high blood pressure, kidney infection or stones, autoimmune diseases like leg plugs, and long-term use of certain painkiller. Okay, so with that being said, let's look at how can we detect kidney disease or kidney, how can we detect the best test to detect kidney disease early, like the creatinine, GFR, and urine protein. These are some of the common tests that doctors use to detect kidney disease. So catching kidney disease early is all about a few simple but powerful lab tests. Do not forget, kidney disease can be reversible if treated early. So this is why we place so much emphasis on you going for your regular checkup. We always preach about prevention because we strongly believe that prevention is better than cure. This is why we place emphasis that you must go for your routine medical checkup because we don't diagnose in Gateway 101, neither do we treat. We always give you a healthcare awareness. Okay, so catching kidney diseases, like we said earlier, is all about a few simple but powerful lab tests. Most kidney problems are silently. So these are the best screening tools doctors rely on. The first one will be tests to detect kidney disease early. Serum creatinine level is a blood test. Creatinine is a waste product from muscle. Healthy kidney filter it out. So if your creatinine level is 0.7 to 1.3 milligram per DL for adult male, then we'll say you have a healthy kidney. But if it is, and for female, your creatinine level should be 0.5 to 1.1 milligram per DL for adult female. Then we'll say you have a healthy kidney. But anything higher than this range, then you are in for a serious trouble. So you need to see a medical provider ASAP. So what matters is if creatinine rises, it can mean the kidney are not filtering well. Because don't forget that the creatinine blood test level, serum creatinine blood test is a waste creatinine is a waste product from the muscle. So if your kidney is functioning effectively and properly, the kidney should be able to filter out all the waste from your blood. So if your creatinine level is above the normal range, then your kidney may not be functioning properly. Okay, limitation. Creatinine alone can look normal. Okay, your creatinine level might look normal in early disease, especially in older adults or people with low muscle mass. Okay, another test again that the doctor may likely conduct to test for your kidney functions will be the estimated glomerular filtration rate, EGFR. This is one of the most important early kidney function tests. So calculated using creatinine plus H plus sex. It shows how well kidney filter blood. So the estimated glomerular filtration rate shows how well your kidney filter the blood. Do not forget that in the end-stage renal disease, which will be a topic for another day, when your kidney can no longer filter your blood properly or filter the excessive fluid, the excessive waste from your body, you will be placed on dialysis. So that's a topic for another day. Okay, so the estimated glomerular filtration rate is one of the most important early kidney function tests. Okay, calculating using creatinine plus H plus sex shows how well kidney filter your blood. So EGFR range 70 plus is normal if no other kidney damage. 60 to 89 might decreases. Watch closely. So the doctor may have to watch you, have to monitor you closely if the EGFR is within 60 to 89. So you have a mild decrease, so they might watch you closely. Then less than 60 for 3 months, you have a chronic kidney disease, CKD. This is not diagnosis. You need to see your doctor. I'm just give you some healthcare awareness. So less than 15 is a kidney failure stage. So you need to see medical doctor. So best for detecting early decline before symptoms appear. The estimated glomerular filtration rate is best test because you detect early decline rate before symptoms appears. So urine albumin to creatinine ratio, UACR. This is the best early urine test. It detects tiny amount of protein, albumin, leaking into urine, often the first sign of kidney damage. So the UACR result, if it is less than 30 milligram per G, is normal. 30 to 300 is early kidney damage. Microalbuminuria greater than 300 significant kidney damage. So to see a provider very quick. Special important in diabetes and high blood pressure patient. Urinalysis, dipstick urine test is a basic screening. It's a basic screening urine test. So they urinalysis check for, which is also known as a dipstick urine test. They check for protein, blood glucose, infection. So why useful? Fast and cheap, but not sensitive. A UACR for early protein leakage. Okay, so blood urine nitrogen, BUN, is measured on another waste product filtered by the kidney. So higher BUN may suggest kidney dysfunction, but it can also rise from, your BUN can also rise from dehydration, high protein diet, and GI bleeding. So it is supportive for the Bexley marker. So kidney imaging, ultrasound. Uh, when the, used when doctors suspect structural problem like kidney stone, blockage, a large kidney, crystal, or tumor. Not usually the first early screening test, but very helpful when abnormality showed up. Okay, so blood pressure monitoring, not a lab test, but crucial. High blood pressure is both a cause of kidney disease, a sign of worsening kidney function. So keeping your BP control in one of the best prevention strategies. Electrolyte and acid-base balance. Kidney disease can affect potassium, sodium, bicarbonate, calcium. Yeah, you can afford bicarbonate, so you can affect all this stuff. Okay, so often check once CKA is suspected. Okay, so best early detection combo would be most recommendable. If you so if you want, the best screening package would be your serum creatinine, urine, ACRO, urine analysis, blood pressure check. So the combination catches most early kidney disease. So who should get tested regularly? We say that you should be screened yearly if you have diabetes, if you have high blood pressure, if you have family history of kidney disease, you are over age of 60, you have swelling in your leg, feet, frequent urination at night, history of kidney stone, long-term use of NSAID like ibuprofen and etc. Early warning sign, but often missed, will be kidney disease can be silent, but watch for foamy urine, which is prone to leak to the urine, swelling in your feet or face, fatigue, high blood pressure, loss of appetite. Okay, this will be some of the early warning sign. Mostly if you have a urine that is foaming or bubbling when you urinate, it's indicate that you have a protein leak into your urine. So you need to go for a further screening. Okay, so let us go and discuss some of the preventive measures that we can put in place, because in Gateway 101 we places emphasis on prevention because we strongly believe that prevention is better than cure. So kidney disease is one of those things that can often develop quickly. So prevention really matters. So the good news is a lot of kidney disease can be prevented or delayed when everyday health habit, especially if you start early. So the best way to prevent kidney disease will be control your blood pressure. Blood pressure is one of the biggest cause of kidney damage, often over time. So aim for a healthy blood pressure around 120 to 180 if possible. Reduce salt intake. Reduce salt in food. Okay, stay active regularly. Manage blood sugar. Prevent diabetes complication, because diabetes is the number one cause of chronic kidney disease. So keep blood sugar in a healthy range. Limit sugary drink and refined carbs. Get regular checkup if you are pre-diabetes or you are diabetic. Drink enough water. Water helps kidney flush out toxic. Drink steadily through the day. Don't wait until you are thirsty before you start drinking. So more water is needed in hot weather or during exercise. But people with heart, kidney failure may need limited fluid intake, so you need doctor advice. Okay, eat a healthy kidney diet. Healthy eating protect kidney long term. Okay, so focus on vegetable and fruit, whole grain, lean protein, and fish, beans, and water. So limit too much salt intake, limit processed food intake, limit excessive red meat, sugary snacks, avoid overuse of painkiller. The use of insects like ibuprofen, like Proxy, can slowly damage the kidney if taken too often. So use only when necessary and as directed. Don't smoke. Smoking reduces blood flow to the kidney and increases kidney disease risk. Quitting is one of the strongest protective steps. Maintain a healthy weight. Okay, obesity increased risk of diabetes, high blood pressure, kidney strain. So even small weight loss helps a lot. Regular exercise, movement improves circulation and lower kidney risk. So aim for 30 minutes most day. Even walking around can't. Also limit your alcohol intake. Too much alcohol raises BP and causes dehydration. Moderation is key. Men must 2 drinks per day, women must 1 drink per day. Get regular kidney check, especially if high risk. You should check kidney function if you have diabetes, you have high blood pressure, history of kidney disease, swelling in your feet or face, frequent urination changes. Best test would be blood creatinine, EGFR, urine protein test. Okay, prevent and treat infection early. Untreated urinary tract infection UTI can spread and harm the kidney. See a doctor if you have burning urination, fever, back or frank pain. Early warning sign not to ignore would be kidney disease can be silent, but watch for swelling in your ankle or face, foaming urine, blood in your urine, fatigue or swelling, loss of appetite, high blood pressure. These are early warning signs of kidney disease. Okay, so remember, in Gateway 101, we place emphasis on prevention because we strongly believe that prevention is what better than cure. So we're going to be repeating the same broadcast again tonight. Okay, for those of you who are at work who could not be able to tune in. But until then, it's goodbye for now. Thank you.